Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. With more than 160,000 cases, New Jersey was certainly one of the hardest hit states during the coronavirus pandemic. Although since May 25th, there's been a fairly steady decline in hospitalizations. And like many other states across this country, businesses are beginning to reopen, hospitals are beginning to resume non-elective procedures, non-COVID cases. With 11 hospitals and multiple care sites across New Jersey, RWJBarnabas Health certainly saw its fair share of COVID-19 patients. The system's president and CEO, Barry Ostrowsky, joins us today to talk about some of the lessons learned during the first wave of COVID-19 and getting ready for what many think will be a second wave. Barry, thanks so much for joining us today.
Thank you for having me, Matthew. Good to see you again.
You too. So I guess that's kind of where I want to start with you is how worried are you about a second wave? We're seeing spikes in some other states, Texas, Arizona, North Carolina. What are your concerns in New Jersey?
Well, I'm convinced, of course, there will be a second wave. The real question is, how will it stress the healthcare delivery system, and of course, ours in particular? I think we've learned that we're able to respond to this kind of pandemic somewhat effectively. If we did it on a moment's notice 3 months ago, we now learned what it'll take to the extent we have a second wave, how we need to staff, how we need to change our physical venues, what equipment we need. So I think we're in far better shape, candidly, to respond if that second wave is a big challenge. One of the advantages we have in New Jersey is we've had a very strict lockdown set of policies. Our governor and leadership at the Commissioner of Health level has been inflexible for a period of time. And I think while we were clearly the epicenter of the virus, I think that will serve us well as we go forward and protect against the acuity of a second wave. But I am convinced we'll have it. I think we'll be in a better position to respond to it when it happens.
So as you think about some of the lessons from the first wave going into the second, are there things as you look back over the past 4 months, three and a half, 4 months, that you would have done differently or that you'll take as you move forward into the September, October, November timeframe?
I think there are a number of things that we will do differently as we go towards the second wave. What we learned, and everyone knew, of course, intuitively, but we saw it loud and clear, is the incredible heroism of our frontline caregivers. And it's been an incredible opportunity for the general public to support them. I think we now know how to better support them when they're addressing this kind of challenge. We've formed teams, which we frankly didn't have before that. We have a series of programs to address their emotional concerns as well as their physical exhaustion. We're in a much better place at this point to honor their heroism on a daily basis and to enable them to perform their services more and effectively without some of the burdens that they had to overcome initially. I think we're also better served in terms of our ability to acquire and distribute PPE. As everyone knows, just-in-time inventory doesn't tend to work when you're facing a pandemic like this. We now know better who should be wearing what. We're building our resources so that we'll have a sufficient amount of supply. I think we also have learned how flexible we can be in decision making. When you're hit with a pandemic like this, you don't have time for committees and task forces and consultancy. You sit down, use your best judgment, and you make decisions, which I think, for the most part, came out as effective guidance for those who are caring for our patients. And I think finally, we've learned a lot about communication. We've all said it for years and years that you have to and can't communicate enough. I think in the case of our system, we have 35,000 employees and another 10,000 physicians who attend or are employed by us. How you communicate, its frequency, what the substance is, I think we've learned how to make those mechanisms more effective. And I can tell you that they are incredibly appreciated. Much of the response that I've gotten always starts with thank you for the information, thank you for the explanation, thank you for the support and guidance. And so I think if you add those lessons and you put it in a new and revised playbook, I think we'll be in a better position to respond. And hopefully the challenge won't be as great, but historically, I'm afraid the suggestion would be that we will be challenged to a significant degree. I'm comfortable that we've learned a great deal, and I'm confident that we'll be able to respond appropriately.
Great. So I think one of the things you've done that struck me as pretty interesting. I understand you started when the pandemic started to hit your hospitals. You asked folks to create daily diaries. Am I understanding that right? And what kind of information were you collecting, and how is that used now going forward?
Well, thank you, Matthew. I did. Having gone through, as all of us have, a series of challenges, the after action reports or the retrospective analysis or postmortems, as they call them, are effective, but they're limited, because if the crisis lasts long enough, some of the early experiences are forgotten, frankly, when it's time to respond to a formal process to try to retrospectively analyze what was done. So I immediately asked people to literally keep a daily diary. And when it came time to go retrospectively, we would cull from those daily diaries what happened. Now, of course, one of the other advantages is you could do it periodically. So if you were a week into it and you look back on your diary for the last week, it was informative of what you may be able to do differently the next week in a more formal way, as opposed to just anecdotally. So we are now more or less through our after action analysis, and much of it has been populated by excerpts from these daily diaries. And I think it's made for us a more effective retrospective review, and has helped compile what is approximately 3/4 of the way through a new plan for when the second wave hits.
And so were those done by department, or did all 30,000 plus of your staff do it?
I gave the message to everybody. I obviously, people on the front line weren't about to sit down necessarily and fill out a daily diary, but it didn't have to be written necessarily. I wanted folks to make observations in a timely way, but at every level of the organization, the message was given to please do that. And I was gratified with how many people, A, thought it was a good idea, and B, actually took the opportunity to do it.
Great. You referenced the governor of New Jersey, who's been very proactive in the lockdown. He's come under some criticism of when to reopen, when not to reopen. I'm curious, as you think about both from a state level as well as the federal level, what level of guidance you've been getting from government officials, and if you think that's appropriate enough as you move into preparing for a second wave.
I think the leadership, candidly, the elected official leadership in New Jersey and the appointed leadership in New Jersey has been excellent. The governor, as you point out, and as I said earlier, has been inflexible. He has made the point with clarity that public health will, in fact, lead how we reopen the economy. And I think it has served us well. I happen to sit on an advisory committee to our Commissioner of Health that meets twice a week. And through the Department of Health, we've been getting guidance on most everything that applies to healthcare delivery. In addition, the Department of Health has provided waivers to what we now understand are more or less artificial barriers to having more efficient care rendered in our facilities. So there has been open communication, very effective responsiveness. And while the governor himself has taken, as you point out, a certain amount of negative response to how he's reacted and led, I think at the end we will see statistics and data that reflects the rightfulness of what he's done in leading us through this. He points out on a regular basis popularity at this stage is really not his major concern, which is good news because he's incurring some of that incoming. But I think from an industry standpoint, certainly the institutional healthcare industry, we've had great involvement, and we certainly have been guided well by our elected leadership of the state.
What about at a federal level?
We have spoken through our federal representatives, and we've gotten obviously a certain amount of support. Clearly, financially, we've gotten a great amount of support from the federal level, and of course, CDC and agencies like that have been very helpful. And so, I think the combination of what we've gotten financially and from policy leadership from the experts in Washington has been very helpful, and we haven't hesitated to provide feedback and commentary as to hey, what we need and anything we feel that could be done better. We've certainly provided that information.
Barry, and kind of lastly, I think we'd be remiss if we didn't talk about the other public health crisis that's obviously sweeping across the nation in the wake of George Floyd's death last month in Minneapolis. We've seen populations of color disproportionately impacted by COVID. You overlay that with the aftermath of Floyd's death. Talk to me a little bit about the imperative now that sets for health system leaders such as yourself to really double down on social determinants. I know RWJBarnabas Health has done some things on the front lines, but where do you go from here?
Well, you said it, doubling down, Matthew. We have been committed to social programs addressing structural and institutional racism, which clearly exists not only on the societal level, but in healthcare specifically. And we see that playing out in terms of how the virus has affected our vulnerable and racially diverse communities for sure. We believe that you can't make your community healthier unless you address racism, unless you address social justice. Unfortunately, those are programs that don't have Medicare codes, and so they have to be funded out of that which you're able to earn in providing conventional clinical care. I think now is the time, it's long overdue, of course, but now is the time that we have to ensure that we address those issues and address them meaningfully. You can't just do it, by the way, in the pure social program sense. It requires economic development. It requires making capital wealth building available to people who haven't been able to do that. The fear I have is that the stress on healthcare facilities because of the virus is such that some discretionary spending that may have gone into those programs could be curtailed. I am proud to report that our board, with whom I've had, of course, ongoing and constant contact throughout this, has encouraged us to not only continue our social and justice-based programs for the community, but to expand them. And so we look forward to doing that. We know we'll get past the virus. That is just a time-sensitive issue, and I, of course, feel badly for those who succumbed to the virus. But we have two centuries, multiple generations suffering from racial injustice, intolerance, and no social platform. That we have got to fix, and that will take a commitment beyond the time frame that the virus will be with us.
Sure. Well, Barry, listen, we appreciate you taking some time out of your busy schedule. We know things are always hectic for CEOs of large health systems. Thank you for taking the time. We'll certainly want to check back in with you on some of the COVID updates, as well as what you're doing on the social determinant front.
Thank you, Matthew. And again, thank you for your leadership. Your organization has always been there to cover that which we're doing. And believe me, we're appreciative of that. So it's great spending some time with you.
Thanks, you too, Barry. Thanks, and stay safe. And now I'd like to bring in our rules and regulation reporter in Washington, D.C., Michael Brady. Michael, how are you?
I'm doing well. How are you?
I'm good. Thanks for joining me today. Michael wrote a story that's appearing in this issue on June 15th, our 50 most influential clinical executives, profiling doctors Anthony Fauci and Deborah Birx, who collectively are running the administration's response to COVID-19. Michael, I think one of the things that you uncovered in that reporting was that while the two of them have done, they've been lauded by the public health community for their efforts, they have faced some criticism behind the scenes for shutting down the economy, for maybe Dr. Birx kowtowing potentially to some of the things that Trump has said, President Trump has said. Give us a little background on some of the reporting you heard as you were going through this story.
So I think, as you mentioned, one of the interesting things that I came across in my reporting was sort of the political dynamics behind the scenes in terms of the differences in approach and also sort of capability between Dr. Birx and Dr. Fauci. Dr. Fauci has been, especially in public, quite willing to sort of contradict to some extent what the president has been saying. He's been very comfortable doing that, and in general seems to operate with sort of less regard to the political realities and difficulties of a situation like the COVID-19 pandemic, where public health is coming into conflict in many instances with the political ambitions of the president and governors, and then also the economic realities of essentially putting a lot of people suffering quite extensively from being laid off from work, and then also socially from the social distancing policies and shelter-in-place orders and things like that. One of sort of interesting anecdote, I think, is early in April, the Trump administration was considering sort of hitting the pause button on funding for the World Health Organization due to what it saw as a problematic relationship with China in terms of how close the organization was to China and how much it was willing to trust the information that China was providing it with without sort of fact checking it or making sure that information was accurate. And so during a meeting in the Situation Room, White House Situation Room, Donald Trump sort of was trying to get a feel for where his staff was with respect to the World Health Organization, although he seemed to have already kind of made up his mind at that point. But Dr. Fauci, when asked about the World Health Organization and its leadership and the organization's relationship with China, was sort of half-heartedly defended the World Health Organization and its leadership, but then sort of directly addressed the question of China and whether it had undue influence in the organization. Whereas Dr. Birx was very critical of the organization, but then let's see, it was a few days later, the administration announced that they were going to stop funding for the World Health Organization, at least temporarily. And although Dr. Birx during press events was actually quite defensive of the World Health Organization and really went to bat for it, as did Dr. Fauci. But that willingness on the part of Dr. Birx to sort of reinforce the president's beliefs behind the scenes, from my understanding, has allowed her to exercise a bit more power behind the scenes in terms of her influence on the president and the administration's decisions, because she is not always sort of combating the president's instincts, but sort of picking her spots and sort of choosing when she should, make recommendations that you may disagree with.
Yeah, and one of the interesting things in your story, which folks can see online, I think, was the comment you had from former HHS Secretary, now Representative from Florida, Donna Shalala, that Dr. Birx's position is a little more difficult than Dr. Fauci's in terms of playing the politics, because she is in more of a political role than Dr. Fauci. He can go back to NIH and continue to do his work there.
Yeah.
I wanted to, in the couple of seconds we have left, I wanted to just touch on something that Barry addressed, and the communication between the federal government and providers. What are you sensing in terms of, or hearing in terms of, a second wave of COVID, and what may be the future of the task force and their communication?
So in terms of what things look like moving forward, I think it's really uncertain. One of the issues we have is while communication between the federal government and states is important, and then also the federal government and states and providers is important, we also have a presidential election in November, which sort of coincides with the beginning of flu season. And so it's not clear how that's going to play out. You would hope that the focus of at least the public health apparatus would be on addressing the public health crisis, but at the same time, the political appointees inside the administration have a very strong incentive to make sure that they're not shutting down the economy and shedding jobs, with the election right around the corner. And so I think that's extremely difficult, for not only for people inside the administration, but also for providers, because, being able to plan for that next wave, which is almost certainly going to come. We may even be seeing, when we're already seeing increases in cases in many states now due to the restrictions being lifted. It's nobody knows what's going to happen, and
Right.
where it's still a very uncertain situation.
Right. So certainly something we'll stay on top of, and I know you'll stay on top
Yes.
of there in Washington. So again, Mike, thanks for taking time to be with us today from Washington, D.C.
All right. Thanks for having me.
Thanks.
Appreciate it.
And thank you all for tuning in, to this edition of The Checkup. Be sure to come back next Monday on June 22nd for a new edition of The Checkup. I'm Matthew Weinstock with Modern Healthcare. Stay safe, everyone.